Good evening, everyone, and welcome to our digital community engagement health and wellbeing event with Birmingham and Solihull Mental Health NHS Foundation Trust, Association of Jamaica Nationals, and Making Connections Work. Good evening, my name is Rudy Page. I would like to introduce Dr. Beverly Lindsay OBE OD, Deputy Lieutenant West Midlands, and also Chair of the Association of Jamaicans, to open the event. Thank you, Dr. Beverly Lindsay.
Thank you, Rudy. Good evening, everyone. Lovely to see you all. Good evening, good morning, good afternoon from wherever you may be watching or listening. On behalf of the Association of Jamaican Nationals, Birmingham, UK, and Birmingham and Solihull Mental Health Trust Foundation, it is a great honor and pleasure that I welcome you this evening to our mental health awareness webinar. The theme, Access, Information, Support, Signposting. This is part 2, a follow-up to a webinar that was held on December 17th last year, a few weeks ago. I do hope that if any of you were here at the last time, you have benefited and sought help, if needed, from our services that presented on that evening. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. Mental health affects us all, whether directly or indirectly. And this is how we manage it at times that counts. Organizing these events is not about building a stage on which to perform, because I really don't like to be speaking in public, but it's a subject that cuts deeply into my veins. Today, January 21st, a few years ago on January 19th, suicide came knocking on my door when I had the devastating news that my son's body was found due to suicide. I cannot begin to describe the pain that swept through my body. At the time of his death, the subject of mental health was not as topical as it is nowadays. So I did not associate his suicide with mental illness. Again, suicide was not talked about in our community. It was somewhat of a taboo subject. So it is kept a secret when it occurs in our families. But after my experience, I began to speak out. And in so doing, I think I've helped others to speak out also. Mental health should be treated like a physical illness. Most people take their lives, as I've said before, really do not want to die. I believe that they just want the pain to go away. However, their pain might disappear, but others are left behind, carrying guilt, remorse, pain, soul searching for the rest of our lives. And it's in some cases leads to further suicide. Immediately after my son's death, I just wanted to do the same. But with the support of some good people, I'm here today. A good friend and my aunt actually moved into my house for nearly a year as what I term now as suicide watch. Losing someone like this is not an illness that you can recover from. It is like an amputation that you have to live with. I would do anything to change that fact in my life. Mental health issues are increasing due to COVID-19. This lockdown has deprived us of so many things that we take for granted. Our civil liberties have been cut back. Social interaction is like a therapy for most of us. It is crucially fundamental to our mental health. We find it difficult to cope when we have no one to share with. The vulnerable are most affected, especially our young people. Our young people are struggling more than ever. They are suffering from chronic loneliness, worried about their education, about the future, the economy, the job market. Young people are going into the future with little or no job prospects due to this current pandemic. Suicide and attempted suicide are on the increase in universities. I was told by some NHS workers on the front line that hospital beds are now filling up with as many attempted suicide victims as there are with COVID-19.
Meetings, give them feedback about this.
We need to catch people before they fall. Please do not suffer in silence. There is help out there. We are pleased to have a team of experts on the program this evening who are uniquely placed to highlight the themes of this webinar and guide you through where and how to access information and support. We are extremely grateful also to have Councillor Paulette Hamilton, Cabinet Member of Health and Wellbeing, Birmingham City Council, to join us, who has joined us this evening. I would also like to acknowledge Handsworth New Testament Church of God, Making Connection Work, for their support to this webinar. I would also like to thank all the facilitators on the panel for joining us this evening. In closing, I would like to put my mind back to COVID-19 and the vaccine. I would encourage everyone in our community to discuss the benefits of taking the vaccine and do what our parents did to protect us when we were children. In short, our mothers ensured that we got the childhood vaccinations against measles, mumps, and rubella, whooping cough, diphtheria, and tetanus. And today we need to take the right action to protect our families and our community from this outbreak of coronavirus, or pay the terrible toll. I lost an uncle yesterday and a good friend earlier on this week. Thank you all for joining us. I would now like to introduce Councillor Paulette Hamilton for our opening remarks. I'll just say a few words about Councillor Hamilton. Councillor Hamilton was a qualified nurse up to the rank of sister before leaving to pursue a career in politics. She was elected councillor of Handsworth Wood Ward in June 2004, and she's currently the local councillor for Holyhead Ward. She was appointed to the role of mental health champion for the City Council in October 2013, and appointed as a cabinet member for health and social care in May 2015. Ladies and gentlemen, I'll give you Councillor Paulette Hamilton. Thank you very much. God bless.
Good evening, and thank you so much for the invite to this event this evening. Those of you that know me well, you know that mental health is very close to my heart. Now, tonight, I was asked by Beverly to just give the challenges in Birmingham. Let me start by giving a quick personal story, and I mean quick, and then I'll go from there. In 2012, a cousin of mine, she was very young, she was in her 20s, wasn't very well, and I met her on the street, and she said, Auntie Paulette, she said, I really need something to do. She had been living with mental health issues for a number of years. And I said to her, just let the snow come off the ground, because at the time it was snowing, and we will get you involved in some sort of voluntary work. I never got the chance to do that because she took her own life. Now, at the time, if she had not succeeded, I believe we could have helped her, but she succeeded, and that was the end of her journey. But it was the start of mine. It was the start of a passion that I never thought I would have, but it was one that I am so very passionate about, people living with mental health issues and it being recognized for what it is, and that is an unseen illness, but it is nevertheless should be treated no less than something, a physical illness. Now, as Birmingham City Council, we work very closely with the Mental Health Trust. We work with the Combined Authority. We do things nationally through the LGA, which I sit on their body, and we work through our political affiliations around this issue, because mental health knows no boundaries. Now, Beverly asked me to speak about the challenges, so I'm going to highlight some of the challenges that we have in Birmingham City Council. Now, Birmingham, it was discussed a few minutes ago about COVID-19, and I'm not going to go on about it, but many of you will know that this variant that is ripping through the country at this point in time is taking many lives. And again, as Beverly will tell you, on Sunday, I was speaking to her on the phone, upset because I'd lost a close in-law and somebody that I didn't expect to lose. But I can say that my parents took their vaccine and I was dancing around the house. So in one breath, I'm dancing around the house, and in the next breath, I'm crying because we're losing members of the community because unfortunately they're getting this terrible disease or virus and it is killing them. Now we're on our third lockdown this year. Psychologically, the Black and Asian community, we love to socially interact. And the last 12 months has been foreign to many of us. We live in intergenerational households. We have not been able to mix the way we want to mix, and that is increasing the levels of mental health in this city. We haven't got our day centres open. We haven't got our leisure centres open. We are not able to go to restaurants. Again, that is increasing our mental health issues. We've got carers at home that have been caring for loved ones for years, but over the last 12 months, they've had no let-up. Again, that is increasing the levels of mental health issues. You've got young mothers out there that are looking after children. They've got no laptops. They've got one laptop between 3-4 children. They're living in flats. They're not getting the level of resources that they need, because even if you can get the laptop, if you can't get the Wi-Fi access or get a dongle, you can't do what you need to do. I don't know about the rest of you, but me trying to do homeschooling and hold down a job is almost impossible. So again, that increases the issues we're seeing around mental health issues. Birmingham, again, is a city of small businesses. Those of you that know me well, my husband is a small business owner. I know other people on this call, they own small businesses. It has been a terrible year for people who are in small businesses. Birmingham as a city, we have been built on small businesses. This afternoon, I'd just like to say to you, with the levels of issues with debt and the problems people are having, actually getting business this year, that is creating mental health issues, and it's leading to depression. Can I then talk about domestic abuse? Domestic abuse in this city has gone up tenfold. People were in relationships, but unfortunately, as a city council, we have seen a massive, massive increase in this area. What we've been able to do is work with other partners, the police, with other agencies, to get people out of these environments, which you will talk more about later on. But again, that is increasing mental health issues. You've got issues around housing, exempt accommodation within this city, homelessness within this city. That is increasing the issues that we are seeing, not just as a city, but as a country around mental health issues. Austerity over the last 10 years, we have had to live with austerity. The issues of COVID and the cost of COVID will be with us for 3-4 generations. You've got young people that are worrying about these things. That is increasing depression and the issues around mental health. You've got air quality and the issues around air quality and what we need to do as not just a city, but a country around air quality. And at the moment, it's increasing the issues around mental health. As a country, at the beginning of COVID-19, this virus disproportionately affected the Black and Asian community, which again has led to the disproportionality of these communities living with mental health issues. I was asked to highlight some of the challenges, and I could go on all night. But what I want to say to you with my opening remarks, events like these are absolutely critical if we are going to learn to recognize mental health, if we're going to learn to stop the stigma, if we're going to look at well-being and how we challenge it and how we ensure we get the best possible, we get well-being sorted out in this city. But more than that, mental health has to become everybody's business. If we are going to get things to change, not just in your households, not just with the way doctors recognize people who are anxious and they're going towards mental health issues, the way the police continually improve the way they deal with mental health issues, the way the public sector deals with mental health issues. We have to learn to continue these discussions, these webinars. We've got to learn as both a local authority, as members of the public that are doing it, that as local organization, that if we don't work together, we cannot affect change. I'd like to stop there and thank everybody for allowing me to speak for a few minutes. But this afternoon, I'd just like to say, keep up the good work, because what you're doing does make a difference. Thank you very much.
Thank you, Councillor Hamilton. Will you stay on for the end to answer some questions if necessary later?
How far to the end, Mrs.
Well,
Lynn?
you can let us know when you need to go. We'll have the question and
I need to go at 7 o'clock, only because I have another meeting.
Okay, so you might not be here for the question and answers.
What time is the question and answers? Do you want me to log back in?
You could, Rudy?
Mr. Page?
Mr. Page? Well, we're due for question and answers, maybe about 7, just after 7.
Yeah, but 7:15 or so, around that time. But we can send you a message.
Damn.
About 7:15, would you be able to?
All right, you send me a message. I've just got to do a quick speech at another meeting, and then I can log back in.
Okay, thank you. We would appreciate that. Thank you very much. Thank you. Thank you. I would like now, I hope he's there, to introduce Bishop Deverton Douglas of the Handsworth New Testament Church of God. He was one of the presenters at the last meeting to update us on what the church's support to mental health. Bishop Douglas, are you there? I can see NTTCG there. I don't know if he's there. Bishop Douglas?
Right, we'll come back.
We come back. I can see,
Yeah.
but I can't hear.
Right. Let's go to Beresford.
Okay, good afternoon, everyone, and thank you again for joining us. Thank you to Beverly, thank you to Councillor Hamilton for their presentations, which really gives us a really good context into how we're going to try and facilitate the next half an hour, 45 minutes or so. I'm really pleased with the amount of speakers that we've got on today, and like I said, this is our second session. I'm just going to share the screen, and as you can see, we've got Cruise Bereavement, we've got Papyrus, we've got Pause, and we have also got Pause, Cultural Connections, Bethel Health and Wellbeing Network, Birmingham Healthy Minds, Catalyst for Change, and bringing us up at the rear is our Chaplin and Spiritual Care Services, the NHS and the NEC group. Now, I'm going to try and share my screen. Hopefully you can all see that. That's moving along nicely, fantastic. And as Beverly and Councillor Hamilton has said, they've talked about quite candidly about their own personal experience around suicide. And I'm really pleased to say that we've got Cruise Bereavement Services with us, and that's where we're going to start. And I've got Adam Page in, who's stepping in again. Good to see you, Adam.
Yeah,
stepping in for
good to see
Leslie.
you.
And I'm going to hand straight over to you, if I may, just to,
Yeah, of course, yeah.
to kick us off, and then we'll go in the order there. So folks, stand by, and we'll save our questions to the end of the presentations, if people would, and we'll take it from there.
Sure, and you can hear me okay?
Yeah.
Yeah.
Okay, good. And I think if you bring the next slide up, I only need the one slide.
Okay.
And a very common mistake, I'll just point it out, on the first slide, you'd spell cruise and you put an I in there. Now, a lot of people do that when they search for this on the internet, and all they find is pictures of cruise ships and holidays and things like that. So it's a joking way that I can point out. But if you do want to look at any of our resources or contact us, make sure you put cruise in the internet without the I, and you'll be able to get onto some of these services that I'm going to talk to you about. So my name is Adam Page, just to say hello. I'm actually a bereavement counsellor, so I work extensively with people who have experienced a bereavement, and I work with the journey that follows that bereavement, the grief that they experience. And in relation to tonight's theme, what I recognise very much is that whilst a person is grieving, they are in their mental and emotional health is very much in a period of transition, and their mental and emotional health is fragile, it is vulnerable. And if that grief doesn't go as it should, if it doesn't follow a healthy path, it could lead to a place where their mental health really begins to struggle and suffer. And you know, I see that fairly regularly, and grief can be a huge factor in causing and affecting and really sort of skewing a person's mental health. So it's important that if you have experienced a bereavement and you're on that grief journey, it's important to recognize when you feel it's too much, when you feel that you're drowning in those emotions and those thoughts and those feelings. If it gets too much, then I would encourage you to maybe access some of our quick ad hoc services that you can kind of dip in and out. And I'm just going to highlight a few things for you and explain why they might be valuable. On a local level, there's a local helpline number here, which is based in Birmingham, and you can phone that and get immediate support. And you can get immediate support over the telephone, talk to somebody who's trained in supporting you on your grief journey. And maybe that's all you need, just, you know, a 30-minute chat on that telephone, that's enough respite for you. Now, if you actually want to continue with the service to a deeper level and engage with one of our volunteers, you can actually have up to 6 sessions, and they will support you via Zoom or on the telephone. And that is beneficial to have something regular ongoing if you feel that your bereavement is a little bit more complicated, needs a little bit more unwrapping or a little bit more support. You know, based on what was said at the beginning, I do work extensively with bereaved by suicide, and I am personally noticing an increase in those kind of bereavements recently as well in my work, as well as lots of clients affected by COVID as well. They're probably the 2 major types of clients I've got at the moment. But also, just to point out, we are a national organisation and there are national resources as well as the local ones. There's the helpline number there again, but you can phone. It provides the same kind of service, but it doesn't feed into anything that's local and ongoing. The reason I put it up there is that it's open for longer hours. It has a greater coverage 7 days a week. There is the website, cruise.org.uk, without the iron. And on there are lots of downloadable, readable, really valid resources. There's lots of things that we keep up to date with, such as we recently had lots of things about how to navigate through Christmas and top tips. And we know from our DATS and Stata book, we had a lot of hits and a lot of people engaging with that and giving us positive feedback. There's one of those little chat bubbles that pop up as well, like when you go into B&Q and they ask you if you want any help. We have the same thing on the cruise website. And that's just really helpful if maybe you're a little bit more introverted and you don't actually want to speak to somebody. It's quite an impersonal way of just getting a little bit of support and advice via a chat function. So that's just another option for you. All these services are free. We're a charity, but everything we do is free at the point of contact for anybody who enters the service. The only requirement to enter the service is that you've had a bereavement, and we support anybody of any age who's had a bereavement at any point in their life. So you've got all that stuff on the website, all the stuff you can download. You've got the helpline numbers. Just a final note, it isn't my area of work, but there is a children and young persons website. There's a link there for you. You can click onto it, and they offer more direct support around children. That's probably all you need to know. Thank you very much for listening.
Brilliant. Thank you very much, Adam. That was excellent. And as you can see from that screen there, that all your information is there that you could possibly need, especially around adult and suicide and loss. And it's really, again, to highlight that today is about information. We are aware that there's lots of people who need information, they need support, and that is what this program or this session is about. Everybody, all of our speakers will give you information. And already I can see a lot of people are using the chat. So if you're not quite sure of the information and you might have a question that you want to pose, please put it in the chat, and myself and Rudy will try and respond to that in the best way possible. And we're going to go to our next speaker now, which is from Papyrus. Really glad that they're able to join us today. They will tell you all about their service. Harriet Foster, really welcome, and thank you for joining us today.
Thank you, Beresford. Good evening, everyone. My name is Harriet Foster, and I'm a volunteer coordinator for Papyrus Prevention of Young Suicide. So we're a national charity. We've been going for over 20 years, and a lot of people still haven't heard of us and don't know about the support that we provide. So I'm really grateful for this opportunity to be here and speak to you today. Thank you to Lindsay and Paulette, who shared some of their stories around suicide. Thank you, Beverly, sorry, for being brave enough to share that with us. I was really sorry to hear your story about how you'd been touched by suicide. I've got some statistics here which come from the Office of National Statistics, just to put this subject of suicide into context. And I just want to take a moment to pause here and say that sometimes statistics are a good way of understanding a problem, but they are quite cold and hard when we're talking about lives lost and communities that have been impacted by these tragedies. So in 2018, 6,507 people died by suicide. That's across the UK. I don't want anyone to call out at this point, but I just want you all to take a moment to think, how many people do you think were young people out of that number, 6,507? And if everyone's had a moment to try and frame that in their minds, Beresford, would you mind clicking forward so we can see the figure there? Okay. So out of that 6,507 people who sadly died by suicide in the UK, 1,866 of those people were young people. And we believe as a charity that many of these deaths are preventable. I wouldn't sit here and say that all suicide is preventable, but we believe that many of these deaths are preventable deaths. And it's important to know that suicide actually represents the single biggest killer of young people in the UK. So this is how much it affects our young people. And Beresford, if you could please go on to the next slide. Sadly, this also represents over 200 school children who take their lives each year. And that for me is the reason why we need people to be brave enough to speak about suicide and to smash through that stigma. We know that there's a big stigma around mental health in general, but suicide is a very difficult and sensitive issue for people to talk about. And if you could go on to the next slide, please, Beresford. Okay, so Papyrus have a support service called Hotline UK. This is a helpline. We're open every day from 9 till midnight. We also have text and email services for young people who don't want to use a traditional phone call. This is something that we've been really trying to get the message out about during lockdown, because as you can imagine, a lot of young people haven't got the same privacy that they would have in normal pre-COVID times. So they can talk to an advisor through text, email, or over the phone. And that's a suicide prevention advisor they'd be talking to. We don't have automated services. So if they're texting, it will be a person who will give them advice on how to keep safe. And we also have a service called Hope Link, where a young person who's considering suicide can work with an advisor on their safety, and they make a little safety plan, which they can then access at a later time. So it's all the reasons that they want to stay safe from suicide. As well as offering support to any young person with thoughts of suicide, we also support those who are worried about them. And we know that that can be a really scary place to be. So if the parents, friends, loved ones, or professionals are worried about a young person and think that they might be thinking of suicide, they can ring Hopeline and ask for advice as well. Thank you so much for letting me speak tonight. It's a real pleasure. I know that there's quite a few other organisations here today, and I would also just like to put it out there that we do a professional debriefing service as well through our Hopeline. So if anyone is working with young people and they're having conversations about suicide, make sure that you're looking after your own mental health as well. And I would encourage you to phone the Hopeline if you need to have a debrief, because that can be an awful lot to take on. Thank you very much for that. I'll post the number in the chat as well.
Yeah. Thanks again, Harriet, and a really informative presentation there, giving us some data about the scale of the challenges that we're facing, particularly with young people. And over the next couple of presentations, we've got Pause and the Cultural Connections. Again, we'll see the diversity and how suicide is really affecting the diversity of it in terms of our young people. And I'm really pleased to say, again, Birmingham being a super diverse city that it is, we've really got a really good cross-section of services. So again, no one really should be suffering in silence. So it's really important that, again, you take the information and really try and share it with your networks right across the community. It's really important. Thank you again, Harriet, for that. Our next speaker is Khadija Sata from Pause. And again, I've known Khadija for a while now. Really great asset to the city, and really thank you also for joining us, Khadija. Welcome.
Thank you, Beresford. Good evening, everyone. So my name is Khadija Sattar, and I'm one of the therapists at Pause. So Pause is delivered by the Children's Society and part of Forward Thinking Birmingham. Can I have the next slide, please? Thank you. Okay, so in terms of who can access Pause, so the criteria for Pause is if you're under 25 with a GP in Birmingham, or if you're a parent, carer or professional accessing support for your young person. So Pause really helps with anything relating to emotional well-being. And I guess our aim is to help boost resilience as well as developing skills for when life presents challenges. I always think that Pause is a really great place to start. It's that threshold before any therapy. And I always think, like when I was younger, and I thought just to have something like Pause around at the start to just kind of understand what well-being is, what mental health is, can really shape our young people into becoming like healthy adults in terms of how to best cope with their well-being and mental health. So what Pause can do is recommend strategies and techniques that aim to make life that little bit easier. So there's often examples of when someone's having a panic attack, how to best deal with how we're feeling, what are the physiological symptoms, maybe how to even improve sleep. And also, I think a big one here is how to better communicate with people that matter. Often, I think we've all got different communication styles, and we think that maybe the best way of communicating is like verbal, but actually it may be that a young person may prefer other ways of communicating, maybe writing, maybe texting, but just really to have that opportunity to know how we can best communicate better. Pause gives practical suggestions and advice too. We are a listening ear. So we're not a therapy service, but we are a therapeutic service. So our team consists of like therapists, youth workers, like psychology background individuals, so various backgrounds. And I guess it's more so providing that space to talk. So our strapline is Pause is a place to talk about feelings, and that's exactly what we do. So Pause can't, so we won't assess or diagnose any conditions. I think when we first began in April 2016, feels like a long time ago now, we were misconstrued for this, but also it's about looking at actually sometimes people want a name to what the condition is, but often when we're starting at the beginning, it's about looking at actually what is happening, how can I best support myself and even others around me. So we won't automatically make referrals into other services either. So if someone needed some additional support, or maybe they needed a higher level support, so maybe like secondary services, then it would be, we may suggest some signpost information, and they would put in the referral. Can I have the next slide, please? Okay, so we are young person led. And what does this mean? So we are the Children's Society. So we involve young people as much as we can in terms of how to best support them. So even with our location now, so we are based in Digbeth City Centre, but due to COVID now, we've been working online like many of us here. So we've been providing a phone and video service. And I guess this really, with this whole COVID situation, it really shook us into finding another way of working. And if anything, it has been accessible. It's just been so great that we've been able to deliver a service through this difficult time, because we know that with this COVID situation, it's affected our mental health incredibly. And sometimes it just helps to talk to someone who maybe doesn't know your background, who's not family, who's not friend, but who's there with that non-judgmental kind of ear and giving some support and advice. So yeah, we are young person led. It's when the young person wants to talk. So it may be we might have someone put in a referral, so a referral to book a session, and they may not need anything until maybe a few weeks time or maybe a few months time. But it's really young person led. So when they're ready for another session, they would request that online. And when we're open, so when we're back open, it would be literally just dropping in. So in terms of registering, so if you're under 14, a parent or carer would need to register the young person. If you're 14 or over, you can register yourself. And you can register on www.forwardthinkingbirmingham.org.uk. And there's a tab there that says pause, and the registration details are all there. You could either call our registration line, which is it's a voice message response. So if you leave a message, we will get back to you. And that's 0207 841 4470. So with this information that you've heard today, whether you think it's maybe suitable for yourself or your families or even your neighbor, anyone in your community, please do share this information. We're a bunch of really happy people doing our jobs. We love what we do. We're here to support young people. So just reach out. Thank you. Thank you, Breastfed.
Yeah. Thank you, Khadija. Excellent. Again, more information, excellent information, very real services that, you know, we can respond in real time. So please make a note of the information, and, you know, please do not suffer in silence. And I know we've got a few schools represented here as well today. It's really important that we connect with our schools. Parents, please pay attention to what your children are doing. It's a really challenging time. As well, wherever you can, share the information as wide as possible. I'm going to move swiftly on. Again, this is really a young people section, if you like. I'm a young person section, and I'm really pleased to introduce Cultural Connections, Nikita Alexander Pilgrim and Gabrielle Ayo, sorry, and they're like a double act, really excellent service that I've come to know over a very short period of time. And we're going to hear a lot more from these young people. Again, this is a young person's project which provides for young people. So this is excellent. So Nikita, over to you.
Thank you, Beresford. So good evening, everyone. My name's Nikita, and I am one of the directors of the Culture Connection. My professional role is a mental health practitioner. I've been in the field for about 10 years, working in forensic inpatient and non-forensic inpatient, as well as community, and also academic research. So my expertise is in ethnic identity, belonging, and mental health amongst African and Caribbean communities. And my colleague Gabriel is going to just briefly introduce himself as well.
Hi there, good evening guys. My name's Gabriel and I'm also part of the Cultural Connection. And I'm what you classify as a community engagement specialist and business owner. I've worked with young children with emotional behavioural difficulties for roughly around, say, 17 years, specifically in a PRU, which is a pupil referral unit. And I always say that when it comes to children, representation is key. And that's what I believe that so many young people do need in their communities, to see somebody that they can relate to that's actually doing something which they might be interested in. So that's what my role is inside the Culture Connection. I'll leave Nikita to finish off.
Thank you, Gabriel. So we're currently in unfamiliar times. Although we're in our third lockdown, it's still very unfamiliar. And as Councillor Hamilton mentioned, you know, our young people's wellbeing is really being negatively impacted. There's disturbances in their routine, there's the loss of protective factors such as school, youth club, and as adults, of course, we want to support our young people, but sometimes we just don't have the skills to communicate in helpful ways, or we might just be going through our own things and just don't have the capacity to do it. So what we do is we support parents and young people by offering one-to-one mentoring and emotional support. So this is rooted in a pro-social model. So as Gabriel said, our services delivered by people that are relatable and that can show that positive outcomes can be achieved with the right support and right guidance, regardless of your situation. Our aim is, so can we go to the second slide as well? Thank you. So that's our Youth Decide service, which I'm currently talking about. So our aim is to primarily build the resilience of young people. So that's through building on their emotional resilience, their confidence, their self-esteem, supporting them to identify how their thoughts impact the way in which they feel and behave, and to supporting them to act in positive ways, including developing positive relationships that will prevent them from exploitation or harm. And also, as part of that as well, we work with a lot of young people that are at risk of criminal exploitation or engaging in serious and organised crime. So we also use interactive interventions to support young people to kind of view the police in a better light and to retain transferable life skills as well. So with regards to our group sessions, we do that through something called forum theatre, which is actually improvisational theatre where young people are able to act as moral agents of different situations. So it's real life situations. It could be addressing domestic abuse, bullying, knife crime, and young people are able to interject in the different kind of scenarios being acted out to change the outcome, and then learn how to apply that to their everyday life. And so that's a service that we are taking referrals for our one-to-one. Obviously, because of COVID, our group sessions have kind of paused at the moment. But in terms of our one-to-one mentoring and emotional support, we are taking referrals for that. And you can see all our contact details on the side. On our website, it's a Youth Decide page if you'd like to make a referral, or you can contact us directly, and that is for 11 to 18-year-olds. We will also be launching in the next 2 weeks a live web chat and telephone helpline service, which is therapeutic in nature. So we discussed with the community what the best times would be, and that's why we've got Monday to Friday 8 AM to 12 PM and 5 PM till 10 PM. That is for parents, carers, any professionals that just might need advice, information, support with regards to their own emotional well-being or supporting that of a young person's. If you feel as though your needs are slightly complex, please still get in touch and we'll be able to assist you. Our helpline advisors are trained in mental health first aid and in dealing with different situations. However, if things get too complex, then that is overseen by myself, and I can take over and support. So if you'd like to be kept up to date with our helpline number and our web chat service, then please do either contact us by email to provide with your contact details so we can let you know when we launch in the next 2 weeks, or just give us a call or follow our social media. Yeah, if there's any questions we can answer in the Q&A section.
Fantastic. Thanks, Nikita, and thank you, Gabrielle. And again, if you can just put your details in the chat for us, because I see there's a lot of people using the chat, and that's where you're going to get your information. And
okay, no problem.
I can see some real good links there between Papyrus, Pause, and yourselves. Maybe there's an opportunity there that you guys can start to share information, particularly around the work that you do. So fantastic. Thank you for that.
Thank you.
Brilliant. We're going to move on, and we're going to go into, again, another well-known organization within the city, Waits. And I'd like to introduce Marcia Lewinson. And she's going to come and talk to us about her services. Marcia, over to you.
Hi, Varys. Good evening, everybody. I'm losing the time working from home and being cooped up in the house shielding. So I hope you're having a lovely evening. Lots of informative information so far. So I'm just going to spend a few moments talking to you about the charity for which I run. It's called Waits, and Waits stands for Women Acting in Today's Society. We're a charity that covers the whole of Birmingham and the little corridor along Sandwell, West Bromwich, Albury and Smethwick. And we provide support to women experiencing domestic abuse currently, or who have experienced domestic abuse in the past. It's really fortunate. I'm glad to be here to talk about domestic abuse, because quite often people don't marry the two situations together, which is mental ill health and domestic abuse. But having gone through domestic abuse, the trauma and the effects can be quite long lasting and can lead to things such as depression, post-traumatic stress disorder and psychosis. people struggle sometimes to deal with the after effect, particularly when there's been a lot of practical or physical implications or links to the violence. They concentrate on healing the physical wounds, but don't necessarily see the emotional or the mental wounds that domestic abuse causes. So at Waits, we take a holistic approach to supporting women, looking at their practical needs. A lot of our clients need support to access housing and services such as social services and other organisations like Papyrus that we've heard today. We also support women in building back their confidence. Quite often when you've gone through abuse, you lose your confidence and your self-esteem, and we provide workshops to enable women to build back those skills. But on a practical level, our support is based around one-to-one support. So each person is assigned a support worker. We work in advocate roles. So if you need to access legal support or any other statutory service, we can advocate and go with you to those services. We also provide refuge accommodation. We have a few refuges around Birmingham that support women who are not accompanied by their children. So there's a variety of reasons why when you've left your situation, you've not been able to bring your children with you. So we provide safe and confidential accommodation for women as well. Our work's also underpinned by counselling because, like I said, the emotional and psychological effects of domestic abuse can be quite damaging. So we provide that holistic package to enable people to develop new skills, but also to live independently as well. I'd just like to share some statistics with you. Councillor Hamilton mentioned domestic abuse and the rise on domestic abuse. And I'm saying it really just to highlight how prevalent it is within Birmingham. So over Christmas, West Midlands Police said that they were called out to a staggering 1,250 incidences of domestic abuse. The force said it was a 60% increase in the same period between Christmas Eve and the 29th of December last year. In all, there was 191 arrests. I'm saying that because sometimes when you're in a relationship, it might not be physical, but if you feel as if you have no control over your thoughts and your behavior, if you feel as if you've been ostracized and kept away from family members, even in particular now when we're being in lockdown and isolated, that if you're being prevented to make calls to relatives, it could be that you're going through domestic abuse. So during this lockdown, you don't have to abide by the lockdown rules if you're going through domestic abuse. I'd like to point you to the government website where there's lots of tips and suggestions on what to do during lockdown if you're going through domestic abuse. And that site is called government.uk domestic abuse. And as for Waits, we've remained open throughout the lockdown, and people can access our services by emailing support@waitsaction.org or telephoning 0121 440 1443. We have a website which is waitsaction.org that has also lots of resources to help you. So the last message I want to leave with you, if you are in any difficulties around your relationship, do make contact with Waits and other agencies on here. Thank you, Beresford.
Brilliant, thanks Marcia. Again, another very informative presentation. And again, please take note of the details, take note of the context. And Marcia, if I can ask you as well also to use the chat just to put the information in, as we're going to move on to the next presenter, which is Bethel Health and Wellbeing Network. Santosh Rai is with us. And again, thank you for joining us, Santosh. You were with us last year, and thank you for joining us again.
Thank you, Beresford. It's a pleasure to be here this evening and hear so much about the great work that is happening out there. And I always look at these as an opportunity to make really, good connections with the rest of the city. And so I'm Santosh. I'm the manager of the Rafa Listening Service for Bethel Health and Healing Network. That is a registered charity that's been operating for about 14 years now. There's two main services, and I will primarily be talking about the listening service. But before I talk about that, I'll just like to tell you a little bit about the doula service. So the doula service offers support to vulnerable pregnant women. So these are women from all sorts of backgrounds. Some of them are refugees and asylum seekers. Others might be vulnerable because of domestic abuse or because of, dependency on drugs and alcohol. So we simply match them with a doula or a doula volunteer. And she's a person that will come alongside that vulnerable pregnant woman and work with her throughout her pregnancy and beyond the pregnancy as well. And often that is just simply means attending appointments, or it could be sourcing some practical resources or things that she may need during the pregnancy. Now, obviously, because of lockdown, we haven't been able to do too much face-to-face work, although some of our volunteers and our doulas are still going out into the community, and where that woman, literally has no other support, they are there for them. Now, the second service is the Rafa Listening Service, and that's a service that I'm the manager of. And that basically provides support to people with low-level mental health issues, such as anxiety or depression, or those who are lonely or isolated, which often is a precursor for reduced emotional well-being. Some people are obviously at more risk, those maybe from disadvantaged backgrounds, people who are experiencing long-term, health conditions or a disability, or those without a support network, which obviously during lockdown has been the case for many people. Some of the support networks that we are dependent upon are no longer there, or no longer there in the way that we need them to be. So we particularly reach out to those who are least likely to access mainstream services, because of, could be because of language barriers, cultural barriers. We know that some cultures stigmatize mental health, and it's really difficult for them to access services because of the barriers within their own communities and in their own families. So we work in those areas where we know that there is the greatest of need. Our service is underpinned by the simple philosophy, that the burden shared is a burden halved. Sharing your story or your feelings with another person has immense benefits, and we know that just talk to somebody, having somebody who listens to you without judgment can make an immense difference to somebody's emotional well-being. So our service is accessible to anybody over the age of 18. You can be referred by your GP, or you can be self-refer, or you can be referred by any other agency. It simply means going online to our website, and you can complete a referral form, and that will be picked up by one of the team. Once you're referred, we will do an initial assessment just to understand what your needs are, so that we can match you with the right volunteer. Now, all our volunteers are trained in active listening skills, and they will work with that individual for up to 12 sessions. So it doesn't mean you have to have 12, it really depends on what your needs are. The listeners are also trained in safeguarding, confidentiality. We've also accessed support and training around mental health and domestic violence. We're looking at sourcing some training around alcohol and drug abuse. Anything that we feel is on the rise at the moment, and all of those issues on the rise, particularly suicide prevention as well. I'm so glad to see that those agencies are here, and we'll love to connect with you. So the telephone numbers are available on the presentation, but the easiest way to connect with us would be, via the website. So Beresford, thank you for this opportunity. It's been so really informative, and I look forward to making some great connections from here.
Thanks, Santosh. Excellent. And again, the information speaks for itself. Please, folks, pay attention and share this with your local communities. And I just want to shout out for those people that are joining us on Facebook Live. I'm aware that we are broadcasting live, so thank you for joining us today. And of course, Rudy will facilitate your questions in a short while. So please, again, if you've got your questions, we're rattling through our presentations. We want you to stay to the end if you can, and if you can't stay to the end, then you have to go. But please pose your question, and we'll try and answer it as we go along. Our next presentation is from Birmingham Healthy Minds, and it's by Collie Ingram, and again, colleague of mine. He works for the services. We look after 60,000 patients across Birmingham and Solihull. So again, this service is well renowned and very available and accessible to our local community. Collie, thank you for joining us.
Hi, good evening, Beresford. Good evening, everybody. My name's Collie Ingram. I'm the service manager for Birmingham Healthy Minds. And Birmingham Healthy Minds is an NHS free service. It's an IAP service, which an IAP actually stands for Improving Access to Psychological Therapies. So it really nicely falls following Santosh, because pretty much we do, quite similar things. So that was, put in nice order, Beresford, well done there.
Thank you.
So in Birmingham, we also cover all of Birmingham, and the criteria that we kind of use really is that if you're 16 and over and you're registered with a Birmingham GP, and you are experiencing common mental health problems such as anxiety or depression or stress, or you're just worried or you're feeling low in mood, you can give us a call, or you can go on our website. I have the website in the link, and the website is absolutely the best place to get all the information from us, because we keep that pretty much up to date, and in IAP things change very quickly, so we're very flexible and adaptable because of any of the national guidance that kind of comes through. We know we're on it really. Trying to think about sort of some of the things that we do, or some of our unique selling point really is that all of our therapists and our workers are highly trained. They have to follow the national IAP programme, so they kind of are accredited and registered with sort of recognised professional bodies, and they're highly supervised, and we really do make sure that we keep up with that really. Essentially, a bit like what Santosh says, once you phone up or you kind of contact us, we will sort of offer you an appointment, that usually is an assessment appointment, and at that meeting, we will kind of work with you to decide what it is that you want to work with. So some of the therapies that we offer particularly are cognitive behavioural therapists. Most of our workers are highly trained in that. We do offer other counselling, sort of IAP compliant therapies like counselling for depression, interpersonal therapy, dynamic interpersonal therapy, and all of these, they sound really wonderful, and they are really wonderful, and they sort of work on different aspects of whatever is concerning you. So that's sort of mainly the difference. So cognitive behavioural therapy will work on what your thoughts and your feelings and your behaviour, and the therapist will work with you to try and kind of decipher what's happening for you. In the same way, interpersonal therapy, we're looking at sort of the relationships, and perhaps that's what's causing your depression or anxiety. So we kind of link it back to and try and find out why you're suffering or why you've got the difficulties that you have. So in terms of kind of how to contact us, like I said, our website is the best place. You can self-refer, so you can call up yourself. You don't have to be referred by your GP. You can text in, and it's BHM 6077 6077, or you can go, like I said, online, or you can call us on 0121 301 2525. Although our phone lines are only operate from 9:30 to 4:30 Monday to Friday. We do offer appointments from 8 o'clock till about 8 o'clock, and we do some Saturdays as well. So we try to be flexible with appointments once you've entered the service. Some of what we've touched on already, some of our therapists are trained in or are kind of like sort of multilingual and can do the therapies in languages, but if we need to use an interpreter, we will do that as well. So we try and widen that out. And because of COVID, we have had to close some of our face-to-face, so a lot of our contacts is via Zoom, via MSN Teams, via video links or phone. And we do run a lot of groups as well. So what we find, a little bit like today, that actually people really value that. People really kind of like learn from each other and support each other. So there's a lot of evidence that, groups actually work. And we've had to learn over the last 12 months how to do that different, like other people have kind of said. I think I've covered everything, but if there's anything anybody wants to know, I'm around, so please feel free to message me and let me know if there's any way I can help. Thank you, Beresford. Thanks,
Collie, excellent. And please put your information, if you haven't already, into the chat so that people can get hold of the website where all that information is. And again, if you are joining us and you've just managed to log on, I know people are still coming in, it's our digital community engagement, health and well-being session. It's the second. We did one on the 17th of December, and it's the second. And in fact, if you are listening, or if you're on the chat there, and you think that these sessions are crucial to supporting us over this crucial period, we've talked about the vaccine, we've talked about COVID and lockdown and the impact of lockdown. And let's face it, we're going to be in a similar situation come March. Let's be real about this situation. And we know that people's mental health and their well-being is being impacted. So please, if you think these sessions are beneficial and it needs to be shared across the wider community, please put that in the chat. Give us a thumbs up, just let us know so that we can continue to do them, because I think one of the things that have come out of COVID is that actually digital platforms is a really great way to communicate. So if you think this is working and if you think it helps your community, please let us know in the chat so that we can continue with them over the coming weeks and months. And if you are experiencing challenges and a crisis at this moment, let me give you our 24-hour helpline, which is 0121 262 3555. I'll give you that number again, 0121 262 3555. And that's the emergency helpline, and it's a 24-hour service. So please make a note of that. We're doing nicely for time, and thank you for our presenters for really keeping to time. And we've got Catalyst for Change coming up next. Good friend of mine as well, who's been doing a lot of work for years across the city on mental health, and it's Tipper Naphtali. Welcome, Tipper.
Good afternoon, good evening, I should say, everyone. How are you?
Welcome. We're very well, thank you.
Good. I've been having some connection issues. I've been sending you messages, but I didn't get any responses. So if I do cut out, can people just let me know, please?
Okay.
So do you want me to just get stuck into it, Beresford?
If you could, please. I'll put your details up there as best I can. So thank you.
So let me just say a little bit about the background of Catalyst for Change first, because it's very closely intertwined with my personal experience of loss, of death and mental health. So I've been working in the voluntary sector since 1978. So a long time. And I love it and I hate it. And I love it because we are able as a sector to do things that many other agencies simply cannot do, because we have that connectivity with the community. Many of us live in the communities we serve. That's always been the case for me anyway. And the bulk of my work has been around mental health, as Beresford has said, but also around developing all kinds of community initiatives to support people who are vulnerable or less well off than others. But in 2003, that changed my course of direction when my cousin, who was a vulnerable man with mental health support needs, was killed in custody. He was arrested, detained, restrained, and actually died in the back of a police van. So when that happened, I was still living in London, so I decided to move back to Birmingham and to use the skills I already had in terms of community development, community action, to try and address some of the issues around mental health custody. And as mental organizations, we sometimes don't talk enough about the very controversial area of deaths in custody, but we need to, because a high percentage of people who die in custody have mental health issues of one form or another. And this is where Catalyst came into it, because I recognized quite soon after being in Birmingham that there were lots of really good organizations on the ground, African Caribbean organizations on the ground doing really good work, but they weren't talking to each other. They weren't working together. They were off in their own little silos doing their thing. And we also, organizations also were less well represented in terms of policy issues affecting. So that's where it was born. Catalyst was developed 5 years, it'll be 5 years in July. And we provide an infrastructure support for our members who are all African, well, mainly African Caribbean organizations working with people with mental health problems, but not exclusively. Our criteria is that if you are an organization that works with significant numbers of people from African, Caribbean, and BME communities, you can actually be members of Catalyst. So we're not a Black-only organization. We provide incubation support for organizations that are developing, at the very early stages of development and need support. We provide a series of events, and we've done quite a few events with the Trust, with other organizations who are present in this chat, actually, and we've done a lot of work, or we have had a lot of support from people like Marcia, who actually sits on our advisory group. And the whole idea of these webinars to get organized and doing more collaboratively. The service I'm going to you now, we up on the developed, using.
Super, I don't know if you can hear me, but sorry to jump in, but you're having, like you predicted, some connection issues.
Yeah, I did say, yeah. Am I cutting out?
Yeah, I'm afraid so, my friend, and we're losing quite a bit of what you're saying.
We can maybe give out Tipper's numbers, Beresford.
Yeah, if we're going to do that. So the Catalyst for Change and the new helpline that Tipper was just about to talk to, it's quite an exciting opportunity, actually. I think he's managed to, I'm going to try and paraphrase if I can, he's managed to, with Catalyst for Change and a lot of other partners, as you can see there, Wolverhampton, Sandwell and Coventry, have managed to fund and develop this new helpline, which is now available. In Wolverhampton, you can see 0800 118 4057. Sandwell and Birmingham, 0800 184 4058. And in Coventry, similar number with a different digit at the end, which is 0800 118 4059. So until we manage to, Tipper, I've just had to really paraphrase for you because your line is quite bad in terms of communication. It keeps cutting out. So I'm going to move on, if I may, to our Chaplin services. Tip, if you do get a better line, we're going to have some questions at the end. If you could stay around for that, would appreciate it if you can still hear me. And we're going to move to our chaplain and spiritual care services, which is part of our NHS Trust, and Carol Wilson, who's our spiritual care lead and head of chaplaincy for the NEC group, David Butterworth, Reverend David Butterworth, and they're going to really sort of look at the spiritual care side of us as human beings and the importance of that and how we support one another spiritually, and also the fantastic services that are around. One of the things that I come to learn over the last couple of months, that chaplain services is really expanding across the region. And it's about locating where they are. So, you know, you can walk into Birmingham New Street nowadays, walk into our local hospitals, and you can get some support from chaplaincy. So I'm going to kick off with David first, if I may. David, Reverend David Butterworth. Are you there, sir? Unmute yourself.
Sorry, we all think we're so terribly organised and then we find out we're not. It's a real privilege to be here again. I was with the group before Christmas and with a similar group last night with Beresford and Carol Wilson and chaplaincy has been around a long time. I'm a Methodist church minister, but I work ecumenically and on an interfaith basis as well. Whilst I'm a Methodist church minister, I'm also the lead interfaith chaplain for the NEC group, which is the NEC Utility Arena, and also the ICC and the Vox Centre. And we do our uttermost to offer a chaplaincy service to anybody that actually passes through any of those venues, and support them with whatever question it might be, and be very similar to many of the people on this group, to be a signpost to specialists. I'm not a mental health specialist, but I work very closely with Beresford and Carol Wilson and many other mental well-being facilities. Inside the NEC group, for example, it has a real pastoral heart for its people. Like many other organisations, universities and workplaces, many are furloughed. But that pastoral care and that pastoral heart and that sense of dignity for people continues. And so I'm still available on the phone or via email or Teams or Zoom to speak and to listen with members of staff. Likewise, at hospitals and at universities, all hospitals have chaplains of many, many different faiths, and also we engage and we welcome pagan and humanist chaplains as well into that network. Just a few weeks ago, just prior to Christmas, I organised a webinar and 175 chaplains registered from all over the place. And one of our keynote speakers was Carol Wilson, and also was like the key focal point at that one was Dr. Justin Varney, the Director of Public Health for Birmingham. And he is a great guy if ever you need to have speakers. And is one of those speakers, a bit like ourselves, that will go to the place to speak with the people rather than be remote. And of course, we're all remote a little bit at the moment, but we're all making a concerted effort to try and be more in connection with each other. So this digital platform that we're now engaging with should not stop when COVID starts to dissipate. It should continue so that we become more cohesive and can engage with each other. If you know anybody that's suffering from any mental health problem or pressure or anxiety issue, and they are in work, let them know to encourage their companies to explore a chaplaincy facility. Certainly in the city of Birmingham, there are 2 or 3 key chaplaincy organisations. One of them is CIGB, that's Birmingham Churches Working Together. And I'm one of their trustees. So if you'd like to find out any information about that, please send me a message. I've put my details in the chat section already this evening. So please don't hesitate. And if your place of work or your school or your social group isn't aware of chaplaincy and well-being and listening, please be that good ambassador for good practice and say, why don't we think about this as one of our core values for this period we find ourselves in now? And certainly as we come out of COVID, let's not let go of all of these wonderful links that we've got, and chaplains can help pull that together. Brilliant. That's my bit, I think, Beresford.
Brilliant, Dave. Timely as usual, sir. Thank you very much for that. Carol, again, just to really just consolidate some of what Dave has said in terms of the growth of chaplaincy and how that works in the trust would be really helpful.
Carol may have had to go because I know she's had a really precious day today.
Oh, okay. I wasn't aware of that.
If I could say a little bit, I'm not technically a member of the trust, but I've been shared in retreats with them and led retreats in the past. And Carol is the head of spiritual care for Birmingham Solihull Mental Health. And she has a network of 25 chaplains from all different faiths and none. And that covers 85 sites in the wider parts of Birmingham. And again, Beresford has the numbers for her.
Yeah, brilliant. Thanks, David, and thanks for your support there around the trust. And again, you can get in touch with the trust quite easily. And again, our website's there, and we can pass that details on to you, and we'll do that in the chat. So we've really come to the end of the presentations, to be honest, and we're now going to go into the part around questions. I believe there are some questions in the chat, and my trusted colleague, Rudy Page, is going to help us facilitate the questions. And please, don't be shy in coming forward, as I know you're not. And again, if you are listening on a Facebook page, please come through with your questions, and we will happily take them before and after this session. So over to you, Rudy.
Thanks a lot, Beresford, and it's been really informative today. And as we know, it's about information, advice and guidance, and we've certainly had that this evening. And what also has been good is some of the cross-referencing between different agencies as well, which is great for the public to know that there is the actual collaboration amongst the providers, particularly in the third sector, where it's important. Those are really drawn from our local communities. And in fact, received some plaudits for the forum as well, because of the diversity, because there's the issues around cultural competencies. So that has been noticed, that it is a diverse forum. Before I go to the questions, Tracy, I think it is, had a hand up. So where is it, Tracy? If we could, or Yasmin. I should have written it down. I thought I'd memorize the name, actually.
I don't have my hand up.
Yasmin. Yes, it's Yasmin. Yeah.
I didn't have a hand up.
Oh, you had it up earlier on. Okay, no problem. Right. Okay, so a couple of things that have come in, Beresford, around young people.
Yeah.
Maybe one or two of the agencies could maybe just jump in. Communication and young people, and as it related to privacy, and there's another point around young people having access to confidence building courses and activities as well. So there's the two things there. The challenges around communication, I guess that's intergenerational, and then the area of privacy, and then also about confidence building activities, courses, etc. for young people. So if there's any of the providers who can address those issues.
Sorry, I was trying to unmute. We can speak a little bit on that. In relation to privacy, if we're talking about now in the current circumstance we're in with regards to COVID, I think that it's about allowing young people to, understanding that young people don't have direct access to their normal social circles, they might not be at school. So I think it's about safely being kind of lenient with allowing them to have a bit more access to social media so that they can stay connected. But it's all about trust. we've explored this topic with young people before, and they've said that sometimes parents, the reason why they don't open up to their parents because they feel as though the parents are trying to find out loads of information, and it's the way they approach it as well. Whereas young people have said if their parents just talk to them in general about things every day, and then maybe mention things as they're going along in general conversation, then it won't feel so kind of intrusive. Whereas when parents are constantly on a particular day asking loads of questions about the same thing, it gets young people's backs up and they'll just shut down and they won't open up to you. So it's best to kind of meet them halfway, develop that trust and understand that they're not going to reveal everything, but as long as you're able to kind of safeguard them or educate them in a way where they're able to make helpful decisions for themselves, then sometimes that's all you can do. In relation to confidence building, if you'd like to make a referral directly to us, as I mentioned earlier, it's www.cultureconnection.org/decide, and you can refer your young person to our one-to-one mentoring team, and we can also tell you more information about that as well. That's for 11 to 18-year-olds. And we also work with parents with that as well, so we'll also be able to educate you alongside that, but whilst keeping confidentiality. I mean, if there are situations where we do feel like a young person's at risk of significant harm or abuse, then we do let them know that we'll have to share that information. But even if we're working with you as a parent alongside a young person, we won't share everything.
Okay, thanks for that. As it relates to the parents then, is there some sort of courses or sessions that parents can go on so that they can have that conversation as well? Because obviously that's something, again, that needs to be well communicated, maybe separately to talking about the communication with young people. So that provision for parents to be able to have those types of conversations. Is anybody able to talk about that?
Can I add something?
Yeah.
So just to the first part. So in terms of the way I understood the question was whether the young person is in a confidential space to take that call. And I guess that's something that, you know, we hope that young people would have that privacy within their home, but truth is that not everyone would have that. So it's just ensuring that they're in a confidential space, so whether that's in the home or sometimes maybe, I don't know, if it's in the garden. Some people are sitting in the car and taking sessions, but it's just about providing that space. And I guess for us, when we're booking these sessions, you know, we'll email and we'll explain this is the criteria of taking our session. If someone's on the way to the supermarket or in a supermarket, we don't encourage taking calls like that. And I guess in terms of confidence building, what we're looking at now, and we've got running actually this week, is online groups. So we do have online groups running for young children, looking at kind of mindfulness, looking at resilience building and so forth. And in February, we've got an anxiety group running for more college, university and older adults. Anxiety, it's a rolling program. So we've got anxiety, we've got stress, we've got low mood and so forth. So all this information is updated on the Forward Thinking Birmingham website. And Rudy, to your point, in terms of parent support, we are here to support parents who have young people. So if you've got a young child who's under 25 with a GP in Birmingham, we can support that parent in supporting their child. And again, we're looking at some parents groups as well, which we'll be running in the future.
Right, that's very helpful. And actually probably linked to that, somebody said that they've attended talking therapies and they haven't actually worked for them. Mm. So have we got any alternative providers on that? Something that can be said about?
I think Collie's got a hand up.
So essentially, if there's lots of different types of talking therapies, so if one particular type of therapy hasn't worked, it may be worth contacting, you know, somebody like us again, because there are different, you know, like I explained earlier, that, you know, therapies kind of work on different elements. So, you know, unless you say you've tried them all, you know, then I'm really sorry that, you know, that it hasn't worked. But, you know, please, you know, please contact us again if you need. And we actually run a group called Compassionate compassionate self for you, so that's actually a good group that we do, that kind of helps people sort of look at how to be kind to yourself and how to give yourself a bit of space really to sort of grow and develop some of those skills that, like Khadija meant, about resilience, about sort of adapting and to the situation that you're in, and just taking some small steps and baby steps to sort of build that up really. And again, we see people from 16 and over, so if people are online and listening and they are concerned about their children, and there are lots of reasons why people are concerned, for all the reasons that people have mentioned today about the way COVID and the lockdown has impacted on us, then please get in touch. If we can't help you, we'll obviously try and find somebody that can. So the important thing is to make that call and reach out really.
Have any of the other providers got anything to?
Sorry, I just wanted to quickly add, one of the methods we use for working with parents and young people is called direct work sessions.
Right.
And it's quite a straightforward kind of method of working, but it means that you both are in control of how you want, what you want addressed, how you want it addressed, and we kind of work with you collaboratively to support your needs. So we'll do sessions separately with your young person to address the needs you've mentioned, and then some sessions will include parents with that as well, and that is actually quite successful, because formalized therapies are not always suitable to different ethnicities or cultures, so direct work just allows that flexibility.
Okay, thanks.
Just before we move on from there, I think there's a expectant parents also need some advice sometimes, and I think we're really fortunate to have our perinatal services with us online. And I just wondered if Leah, if you wanted to say something very quickly about expectant parents and some of the challenges that they would have, obviously before, during, and after.
Good evening, everybody. Leah Berry, team manager for one of the perinatal mental health services in Birmingham. I probably have direct messaged half of the group already, but it's nice again to mention perinatal mental health services. So we are here to support the moderate to severe mental illnesses of pregnant and postnatal women up to 1 year, especially within such a diverse group that we have on the line tonight. Black women are 5 times more likely to die in pregnancy or postnatally or during childbirth. So, this isn't just a pandemic in terms of COVID. It's not just pressing in terms of comorbidities of mental illness. We're actually talking about mortality rates here. And I suppose this is also a petition to you guys as our community, as our third sector organisations. Over the next couple of weeks and months, we are going to be contacting you. We've developed a Black Perinatal Forum, recognising that actually considering the demographics of the community that we serve, the women that we end up having in perinatal mental health services don't reflect the community that we have. So we're not having the diversity, we're not reaching the communities that we need to. So if you have women that have struggled with bonding, with severe anxiety, that are on the spectrum for bipolar, schizophrenia, severe depression, severe anxiety, we are here. So I'm really happy to see the doulas here, to see, all of the other services. I will put my contact details in the chat again, and the email addresses for the teams. We're very lucky in Birmingham. We have teams across from Sandwell, Birmingham, East Birmingham. I've set up a new team in Solihull now as well. So yes, I'll put my chat and email address down there. Thank you, everybody.
Right. Brilliant. And just before we move on, because we're still on that parent stuff, Harriet, I noticed you just put something in the chat around your child and a guide for parents. I think that's really important. So Harriet, if you could share that as well. Thanks, Leah.
I should say as well that again, the Hopeline, that we take calls from parents who are worried about their children when it comes to suicide. So that they can use that service if they're worried about someone. We've got the online guide as well. Thank you.
Brilliant. Thank you.
Great. David, you put into the chat room about training and around chaplaincy, and you mentioned about spiritual care. I just wondered if you could just for a few moments give us an overview of that.
Yeah, chaplaincy is an open door. Often people think it needs to be the local vicar or the church minister. It very much doesn't. I happen to be an ordained Methodist minister, but most of the people that I work with, certainly at the NEC, and certainly, let's say, for example, in West Midlands Police, West Midlands Fire Service, the Palisades, the Bull Ring, the shopping centres, the railway stations, National Express, a lot of those chaplains are lay people, which means they're not ordained, or they're not the imam or the rabbi. In Birmingham, there's 2 or 3 organisations of long standing. CIGB is one of them that has a regular training programme that starts up twice a year, and it runs in the evening, so people can actually come to it after work. And I'm sure there's other flexibility if people are on difficult shift patterns. Also at Newman's University, they have a degree course on chaplaincy for community workers and youth workers. So there's several different avenues. And if anybody's interested in that, give me a contact and I'll happily signpost you into the right direction. Often, if you're interested in being a chaplain for the fire service or the police service or a university or somewhere like the NEC or the utility arena, people will say, well, come and spend a few shift patterns with me, see how it fits you, and then see where the training might be able to be organised for you. Of course, we need to be really careful with safeguarding, because we hear some very personal, intimate details, and we need to have people that are registered by their sending group, as it were, their sending community, and then do appropriate vetting and checking as well. But chaplaincy is one of those spaces that's often not spoken about, but as Dr. Justin Varney said a few weeks ago, it's of unbelievable value, and many of the nurses and doctors in the Queen Elizabeth and in other places at the moment are depending on chaplains to support them when they have to deliver terrible, life-changing news.
Yeah.
Give me a call if I can help. I'm always happy to take your call.
Thanks a lot for that. Back to you, Beresford.
Okay, just again, thank you for your comments in the chat. I can see that Yasmin's on the call. Hi, Yasmin, just saying hello. And Yasmin runs a project called My Sister. It's a CIC company and looks after young women in particular, 14 to 19. And apparently it starts tomorrow. So please, again, the email address is iamMySister.cic@gmail.com. There's an Instagram and Facebook. So that's My Sister CIC. Great service there. I've had Yasmin on the radio, and she's told me about the fantastic work that she's doing. And again, young people in Birmingham, they deserve some credit. Sometimes young people get a bad rap, but my experience is that there's some great young people in the city of Birmingham. And also, again, of course, Birmingham Healthy Minds. That number again is 301-2525. Again, if you need that service, it's 9:30 till 4:30 on a daily, and some services over the week. Adam, did you want to just give out your details again for us, please? Again, if you're experiencing bereavement and loss and suffering from grief, I think it's really important to try and...
I'll put it in the chat. So I didn't do it, did I? Because I went first. No, I'll put it in the chat.
So it's all right, Adam, if you could please just put that in there, because I think people still want some of that information. And again, as Khadija reminds me, please always speak to your GP. You know, if you are struggling and can't get the kind of information that you think, even though we're providing it here, always go and have a chat with your GP. It's really important that we say that tonight. Really speak to your GP. And again, always remember Marcia's project waits. Again, I think her details are in the chat. Please go to all these, let me just see if I can find it. I'll just give you Forward Thinking Birmingham's website, www.forwardthinkingbirmingham, birmingham.org.uk. Okay, and I think we're coming up to the end, I think, unless we've got any questions. I can't see any hands going up.
summary time, I think.
Yeah, I think we're going to a summary now. So if you would please, Rudy.
So we'd like to invite Latvia to give us a summary, please, from the Trust.
Okay, thank you very much, everybody. It's so lovely to see so many people I know well as friends, colleagues, people in the community, but also to meet lots of new people this evening as well. It's amazing what you can pack into 2 hours, isn't it? I really have been so impressed with the work that Rudy, Beverly and Beresford have done, particularly in pulling these events together and in getting such a diverse range of organisations and individuals talking about a whole spectrum of different issues related to mental health. And I was asked to do a summary, and I was thinking, oh my goodness, how do I do this when there's been so much shared this evening? We've talked about support for bereavement. We've talked about support for people impacted by suicide, the strategies and techniques that organisations are providing to support well-being, the support being offered to young people in developing their resilience, particularly through mentoring and emotional support. We've heard about the support available for victims of domestic abuse, and particularly those who develop mental health issues as a result. Support for vulnerable pregnant women, for those who are lonely and isolated. We've heard about the range of psychological therapies that are available across our city, and also the support for organisations like yourselves, support for the organisations who, on limited budgets and with limited capacity, are still providing excellent services for our communities, and particularly the support available for Black, African, Caribbean communities. And then, of course, on top of all of that, the support that's available around spirituality, and particularly, I love the point that David emphasised, which was the spiritual care support for people with religion or belief or none. This is a very inclusive approach to the way that spirituality is considered in the context of mental health and support. We face very challenging times, don't we? It's pretty awful at the moment, and it's very easy to become really low in mood at all the challenges that we face. The awful impact of COVID and the adverse impact of COVID on particular sections of our community. We've got issues now about the challenges around the COVID vaccine and some of the hesitancy around that and some of the misinformation. We've got the huge issue about the way that COVID has really brought into harsh focus the inequalities that we've known about for a very, very long time, both in terms of health inequalities and inequalities in the workplace. Of course, we're very aware of the issues that, again, are at the forefront of our minds around racial justice and the way that, although we're very proud in many ways to be a super diverse city and community and population, not everybody is equally valued and not everybody has the same life chances. And sadly, not everybody feels that they have a positive experience of mental health services, either in terms of access or experience, but more importantly, even ultimately in relation to the outcomes, that actually access to mental health services results in you getting better through having had a positive experience and making a recovery that you're comfortable with. So I was really struck by something that Paulette said at the very beginning, which was that, we really need to work together to continue these discussions, to support each other, to affect change. And I strongly believe that there are some real opportunities available for us. These events have developed, from my perspective, a really solid foundation where we've been able to share information, get together, get to know each other, understand the support that's available. But it also provides us with an opportunity, as I said, I think at the previous event, for us to come together with a collective voice. At the end of the day, the organisations represented at this event are working at grassroots level. There is a true understanding of what the issues in our communities are, and I would humbly say, actually, are very, very confident and understand some of the solutions to those issues. And when I say there are opportunities, I would like to humbly suggest to the organisers that as we develop these events further, that we actually start thinking about how we can use this forum, other forums, and our collective voice to engage with those. So as just a couple of examples of that, the Trust is a pilot site for a national programme through NHS England called the Patient Carer Race Equality Framework. And this is about developing organisational competencies around improving access, experience and outcomes for people of diverse backgrounds. The really important bit about that is that it has to be service users, carers, families and communities who help organisations understand what it is that we need to improve. And you will be hearing more about that, and we will be inviting you to please work with us so that we learn with you and we produce with you whatever improvements we can make ultimately to services. There's another piece of work which is a national pledge that our trust in Birmingham and Solihull, along with 35 other mental health trusts across the country, have signed up to, which again is around tackling inequalities in mental health experience. And in our trust, we are focusing on 3 areas of service. So one is secure care. The other is improving access to psychological therapies, the service that Cully has talked to about. And the third one is around perinatal services, which Leah referred to. And again, we would be wanting to learn, work, co-produce with you and recognise that whatever we've done previously has not resulted in the positive improvements and outcomes that we really aspire to. The other thing I just wanted to alert you to and ask for your help with, really, we've shared a lot of information about the support available, but there are also opportunities available for people in our communities as well. So if you go onto the NHS Jobs website and search for Birmingham and Solihull Mental Health Trust, and indeed neighbouring mental health trusts, there are lots of paid work opportunities available at the moment. As you will understand, the current situation has had a devastating impact on our own staff, and our sickness absence, you know, it's not good. We have lost colleagues through this period, and we need your support in getting the message out to communities that there is paid work available as healthcare assistants, as admin workers, and if people don't necessarily want paid work, there are so many volunteering opportunities. For example, we have set up a COVID vaccination hub at Ashcroft in Winston Green, one of our trust sites. We're raring to go, but we haven't got the capacity to staff it. We need staff and we need volunteers to support us in rolling out the COVID vaccination programme. So that gives you, I suppose, a sense of some of the opportunities for us to continue our really fantastic, you know, discussions that have taken place. I just think this is such a solid foundation on which we can build to really, in Paulette Hamilton's words, really affect change by coming together, working together, learning together and co-producing. Thank you so very much for giving me the opportunity just to try and summarise what we've talked about during the session, and also hopefully give you some hope that this isn't just going to be, you know, 2 sorts of online sessions. Actually, there is so much we can do through this particular platform, and I hope that you continue to engage with that. So thank you very much.
Thanks a lot for that, Lakshmi, and also particularly for the additional information about community involvement within the health and social care system, which is so important. And because if we're going to improve representation, we've got to encourage the public and their families to get involved. So that last piece of information, I think, is really vital. So thank you for that. And we'd now just like to call Mrs. Cynthia Spence, the AJN Company Secretary, to give us the vote of thanks. Thank you.
Well, good evening to everyone, ladies and gentlemen. I'm Cynthia Spence, Trustee and Company Secretary of the Association of Jamaican Nationals, UK. To our most valued viewers, all our guests, participants, I am so delighted to offer the vote of thanks on the delivery of part 2 of this digital community engagement, health and well-being event. I, on behalf of the Association of Jamaican Nationals, UK, Chairman Dr. Beverly Lindsay, the Management Committee, wish to acknowledge all the supporting organizations. May I express my sincere thanks to all who have contributed to the delivery of this very informative event, namely Councillor Paulette Hamilton, Candidate Member for Health and Wellbeing, Birmingham City Council. We thank you, Councillor. Bishop Deverton Douglas, New Testament Church of God, Lascelles, Latvia Rellan, Director of Community Engagement, Birmingham Solihull Mental Health Trust. We thank you, ma'am. Well, we had so many beautiful and well presented sections this evening. So to all our presenters from the different organizations, Cruise Bereavement, Adam Page, we want to say thank you. Papyrus, Harriet Foster, Pause, Khadija Sata, Cultural Connections, Nikita Alexander Pilgrim and Gabriel, Waits, Marcia Lewinson, Bethel and Healing Wellbeing Network, Santosh Rai, Birmingham Healthy Minds, Cully Ingram, Catalyst for Change, Tipper, lovely to see you, Tipper. We'll be in touch soon. And Chaplin and Spiritual Care, NHS and NEC Group, Reverend David Butterworth. Well, and last but not least, our most eloquent organizers and facilitators, Mr. Rudy Page, Making Connections Work, Mr. Beresford Dawkins, lovely to see you, Beresford, Birmingham Solihull Mental Health Trust. We haven't done any music for a while. We need to talk. You will appreciate that events like these does not happen overnight. The planning, the organizing, the ensuring that key organizations and persons are engaged, especially in these challenging times, which we have become accustomed to since March 2020. The use of virtual digital platforms to share information. Thank you for your continued support as we aim to deliver key and valuable information to our community. I leave with you this quote: "Alone we can do so little. Together we can do so much more." Have a good evening and thank you so much for your kind attendance to this platform. Over to you.
Beresford, I'll give you the last word. But you got to unmute.
Oh, again, thank you, everyone. It's been a fantastic event. And surely by your responses, I can see that we need to continue this. I always have to try and behave myself when the boss is in the room. So I just always thank you for your support. And we want to do this. There's a real commitment from the Trust to keep these things going. And as long as, you know, people like Catalyst for Change, we're doing so much, and again, Wait, and all of you really. And Adam, it's always a pleasure. Thank you for stepping in on behalf of Leslie. And it's always good to have crews in the way that we have them in the space. Khadija, Santosh, everyone really. I'm really getting to know you quite well. And, you know, we've got this space, and I say it all the time, you hear me say it all the time, let's use it, because together we can do so much in terms of change. Already we're starting to see some change happen. We don't need permission. We've got digital platforms now to have those discussions. And again, thank you also, Beverly Lindsay, for your time. I know you work tirelessly all over the year. We can hardly get hold of you, but once you crack the whip, myself and Rudy jump into line. So thank you, Beverly. And again, thank you, everyone. Have a good evening. We're right on time. And thank you again. Thank you.
Thank you very much, and good night.
Thank you.
Thank
Good
you.
night, everyone.
Thank you. Thank you.
Thank you all very much.